It's estimated that more than 40% of U.S. adults can't afford to pay a $400 medical bill as the result of an emergency. But some hospitals are now offering financial services that are clouded in controversy. Take a look.
Imagine you're going into surgery and a hospital employee comes in to offer you a loan. Hospitals are increasingly teaming up with lenders to offer on-the-spot loans to make sure patients pay their bills. But experts say pushing bank loans at hospitals, and particularly in emergency rooms, raises major red flags. This leads vulnerable patients to potentially pay far more than they should. But sick patients might feel obligated to sign on the dotted line in what could be a life or death situation. Could this bedside borrowing be a solution to rising healthcare costs or a ripoff?
Patient advocate Lisa Blackstock joins us with more insight into this growing trend. Welcome, Lisa. So, Lisa, tell us how your own experience with healthcare bills led you to become a patient advocate now.
Well, 10 years ago, I unfortunately found out I had to have brain surgery. And that was bad enough, but when my insurance company told me that they weren't going to cover the cost for my surgeon because he was an out-of-network surgeon, but there was no in-network surgeon who could help me, I decided to appeal, and I won. And my neurosurgeon told me that I was the only patient that he ever had who had won on appeal, and would I be willing to help his other patients fight similar appeals? And that's when I formally became a patient advocate.
Now that you're a patient advocate, have you heard of patients being met at the hospital in the course of pre-op or an emergency situation where the hospital is trying to get them to sign loan papers so that their medical costs will be guaranteed?
Yes, I have heard of this. It's becoming more of an aggressive practice, in my opinion. It really is an unfair situation to put a patient in. The other thing is, you don't really know what you're paying for. A patient has rights, and one of those rights is they are allowed to know on an itemized breakdown what it is they're being charged for. When you're presented with loan papers, all you have is a total amount. You have no idea what is being billed to your insurance, how much your insurance is going to pay, and it just simply is not fair.